all talk about diet and exercise, but we rarely talk about this lifestyle factor in prostate cancer prevention. I believe you know what I'm talking about. And you will all agree with me that what I'm saying is correct. You see, there is this saying by people that you only need to worry about the prostate after age 50. This is an absolute myth. It is not the fact. It may be correct, but that's not the fact. It is a myth because it's a misconception. The fact is that habits in your 20s and 30s matters a lot. It does matter. Because the 20s and 30s are the foundation years for you. They are the foundation years. Now, the chronic inflammation and cellular damage don't happen overnight. No, it doesn't happen overnight. Habits like a high-fat diet, smoking, or sedentary lifestyle in your younger years can create a biological environment that favors cancer growth later in life. If you don't know that, I am telling you now. Now, the title of our session today says, does a lack of lack of intimacy actually harm your prostate? I'm asking men this question because it has nothing to do with women. Of course, some women get into their husband business. But this question is strictly for men. Does it? I don't know, you tell me. Now, before I answer either yes or no, I want us to listen to what the data says. Because the relationship between sexual health and the prostate is a topic of ongoing study. It never ends. It never ends at all. The research is still going on. All the researchers are still researching on it. Now, here is what the current evidence suggests. What the researcher says currently. Let's talk about it. So we want to look at what the data, the researcher says about prostate. Connection with intimacy. Now, there's something they call prostate stagnation theory. Prostate stagnation theory. PSD. PSD is one of the most popular theories among researchers. And what does it do? What does it say? It suggests that frequent ejaculation helps flush out the prostate. Pay attention to that word, ejaculation, frequent ejaculation. So this is telling you that it is not about having sex all the time. Now this is the idea. The idea is carcinogens, that is the cancer-causing substances, and toxins can build up in the prostatic fluid. This means that ejaculation flushes the prostatic fluid. And what do you get when this happens? When you release, when you come, whatever you call it, ejaculation, come, release, when that happens, it helps men clear the fluid regularly, which prevents these substances from lingering or damaging the cells in the gland. I believe you get that point. So what this is basically telling us is, it is not about having sex, but about about ejaculating. Because men can ejaculate without having sex. Yeah, you can. If you want to prove me wrong, come on. Say it. You can come. You can release, ejaculate, whatever name you want to give to it, without having sexual intercourse. We all know that. So, having sex does not prevent you from having prostate cancer. At all. It doesn't. That's not what prevents you from having cancer. But the ability to ejaculate does. When you are able to ejaculate, release, come, whatever name you want to give it, that's what prevents you. Because you flush out cancer-causing substances, carcinogen and toxins that have already built themselves in your prostatic fluid, which damage the cells in the gland. So a lack of sex, sexual activity does not cause prostate cancer. If you are not having sex, that is not what causes cancer. That is not what makes the cancer cell in your prostate grows. However, there is a significant amount of research suggesting that regular sexual activity, specifically ejaculation, might actually help lower the risk of developing it. Now, I said something in my last week's section, last week's show, when I was talking about the step-by-step process of how the blood flow creates the erection. The first step I mentioned was the signal to open the gates. If you are on my show last week, I mentioned something like that. And if you are not, go and watch the recorded video on my YouTube channel, Healthy Living with Bofa. The signal to open the gates. This tells us many ways we can get stimulated or aroused, either through thought or touch. I also mentioned, I illustrated it, telling you that a lot of men, they get hard. Mere looking at you, when they look at you, they are already in that mood. Looking at you, with either the way you dress, either the way you look, either your complexion, your lips, your boobs, your anything that can attract them. Whatever get them attracted, without touching you, they get, aroused. Some will wait until they touch your body, until they kiss you. Some will wait until they have sexual intercourse with you. Those are the things that open the gate I'm talking about. Either way, the brain must send a signal down the spinal cord to the nerves in the penis. If you don't get aroused by this, whichever ways, by touch or by thought, the brain will not send that signal to your spinal cord, to the nerves, and then go to the penis. It will not happen. You have to get aroused first by these ways. These nerves now release nitric oxide. Now, I'm going to focus on the thought to prove you that having sex does not prevent you from having prostate cancer. Let's focus on that. Because we are trying to make you understand that having sex does not determine you having prostate cancer or not having it. So if looking at a woman can get you aroused, it means that you are not going to go to that woman you are just seeing for the first time and have sex with that woman. It is not going to happen. You will definitely, you either go to the woman and talk to the woman, and if the woman accepts you to have sex with her, then you go ahead. And I'm talking about prostitute. That can happen with prostitute. But that can never happen with a woman you don't know at all. But you get stimulated, aroused by looking at the woman. So let's just assume that you don't have access to the woman. You just see the woman afar. And you get hard down there. How do you release yourself? You either go in there and get it out. That is the only way. Now, you did not have intercourse and you still ejaculate. That is exactly what I'm talking about. It's not about kerewa. I don't know. What prevents you from having cancer is by ejaculating. It is when you release that fluid out. That's what prevents you. Yeah, you need to discharge that fluid out. So, a lack of sex does not prevent prostate cancer, nor does having sex regularly prevent prostate cancer. However, you can if you are able to ejaculate. That is what the data says. Google it, research for it. So if anybody tells you that if you don't have sex, you'll probably be prone or you are at risk of cancer, prostate cancer, that is not true. Tell the person that I don't have to have intercourse with a woman before I can prevent cancer, prostate cancer. Tell the woman, tell anybody like that. Because I saw a video going viral where a man, it's even a doctor. That video was a doctor telling people to have sex 21 times a day. I think a day or a week. No, you don't have to have sex with a woman. It will happen if you want to. I have a couple of men, friends, family, brothers, cousins. Some of them tell me that looking at a woman like this, they get hard. They get aroused. And what do? They will definitely discharge. They know how to do it. They get it out. That is what prevents you from having cancer. Does it have to be sex? No, it doesn't have to be sex. Tell anyone like that. The research generally focuses on ejaculation frequency, not the specific method. It is not the method. It's not how you do it. It is about bringing it out. Whether the ejaculation occurs through sex intercourse, masturbate, or nocturnal emission, wet dreams, nocturnal emission, wet dreams. Either way, the potential biological benefit appears to be the same, nothing different. Either way you get this thing out, you ejaculate, you are still going to get it throughout. Either way. Yes, you are going to get it out. Do you know that men who ejaculate 21 times per month, monthly, not weekly, not every day, per month, that's what the data says. Those men who ejaculate 21 times a month, they reduce risk of prostate cancer by up to 20%. And why is this 21 times? Why is this 21 times magic? the magic number for men's long-term health. Now, listen to this. What the research says is the most famous study, I'm talking about the study done by Harvard University, the most studies found on this topic by Harvard, which followed nearly 32,000 men. Listen to the numbers. 22,000 men. It's on Harvard University website. Go and look at it. Research. If you are a good researcher, you will see what I'm talking about. Nearly 32,000 men for 18 years. That was a large-scale project for that university. Very huge one. Now, in this study, there's what they call the 21 rule. This study found that men who ejaculated 21 times or more per month, either through sex, masturbation, ejaculation, whatever way you get it out, they had about 20% lower risk of prostate cancer compared to those who ejaculated only 4 to 7 times a month. 21 times a month, it's okay. 21 times a month, it's okay for you to have sex every month. If you are married and if you are of that age. You see, this, I don't know, this idea of you have to wait until you get married before you have sex, it's okay. That is religious. I'm not going to come here and tell you not to do that. But use your brain. Use your brain. Because a lot of things we do that gets us into health trouble, health problem. We don't even know where it's coming from. It started when you were young. Come on. How do you want me to explain that? It started when you were young. You are at risk if you fall into the category of people ejaculating 4 to 7 times a month. If you are married and you are doing this 7 times, I'm not even going to say 4 times, you are doing it 7 times or less. What am I even talking about? If you are doing it less than 21 times a month, you are at risk of prostate cancer. I'm not talking about having sex now. Before you join us, I've said so many things that make you understand that it is not about having sex. It's about ejaculating. You have to discharge that thing out of your body. If you don't, a lot of people can be having sex and at the same time they are not coming. You use come. They are not ejaculating. They don't release. Some men will go 2, 3, 4 times. They will not release that thing out. You have problem if you don't know. I'm telling you. If you have sex, you go about 2 rounds or 3 rounds. At least you must come once. From those 3 cycles, you must come out once. You must discharge. You must release, ejaculate at least 1 time. If you go first and second, third, and those times you don't release, then you have a problem. Something is wrong. So what I'm talking about, let's do the calculation. 21 times a month. Divide that 21 times by 30 days. You are actually going to have sex 5 times weekly. I don't know how you are going to do it. Maybe you are going to have it every day, Monday through Friday. Or you are going to dedicate those 5 times for your weekend, Saturday and Sunday. Now, I'm talking to married people now. I'm not talking to you if you are still single. So this is telling you that you should get hooked. Get hooked with someone, with a partner, if you are of that age, because you need it. Now, dedicate those 5 times for your weekend, or you do it every day, Monday through Friday, then you relax on weekends. Let's just assume that you are going to be doing it to start with. If you have not been doing it, you can start now. Doing it 21 times a month. You would definitely be doing it 5 to 6 times a week. We have 7 days a week. Do the calculation. Give yourself a schedule. Put yourself on a schedule. If you're a woman on this show, I'm talking to you now. If you are able to give your man those 2 foods, I don't see reason why your man would look out there for another woman. Now, there is one thing to give your man those 2 foods. There is another thing you need to do to keep that your man to yourself. Because I've seen many women calling me, oh, Dr. Betty, all these things you are talking about, because I've talked about it before now. Because this show has been in existence for over 5 years. Yes, I've been talking about wellness, nutrition, healthy living for over 5 years. And I've mentioned it to my gender, what they need to keep their men to themselves. So if you are giving your man those 2 food, the food I'm talking about is edible food. Cook a good meal for your husband. There are some men, those 2 things, those are the things they cherish in their entire lives. There are men like that. They love food so much, and they also love sex so much. If you see a couple's husband and wife loving each other, nobody is getting between them. Go and do your research. That woman is doing those 2 things, and that woman looks so beautiful, neat, unique, and hygienic. You will never lose that. That man will make sure he keeps you to himself, because you are supplying all the material the man needs to live healthy life. Yes. If you are unable to do this, then there is a problem somewhere. There is a problem somewhere. So if you have your sex 5 times or 6 times a week, that is exactly, you have a 20% lower risk. If you have it 7 times weekly, that's about 28 times for you. You increase your time by 7. That is, you are doing it every day. Monday, Tuesday, through Sunday. Maybe you are going to do it every night or early in the morning. Choose your time. That gives you 28 days. Now, if you do it 2 times daily, if you do it 2 times daily, that is 14 days a week. Now, multiply 14 by 4 weeks. That is 56 times. You are actually doing it 56 times a month. That 56 times a month gives you 55% lower risk. Right there. The other 45% can come from diet, healthy food, lifestyle, exercise. If you can do this, you can prevent prostate cancer. Come on, you can. Some men are dying in silence. They are dying in silence. I've listened to many men complaining that their wives they do not want to do it at all. They either complain, I'm tired. They either complain, oh, I'm please. I just came back from work. This and that. Unnecessary complains, we give. I'm your gender, and I'm telling you the truth. Now, when they do that, their husband gets used to that. Don't let me go and touch her because she's just coming back from work or from party. Some can go to party and do whatever they want to do, get exhausted and come back home and still complain to their husband. Oh, I'm just coming back from. Excuse me, that is your own pleasure. Give it to him. Do not trade whatever belongs to your husband. Don't do that, please. Now, here is where it gets tricky. Age matters. The protective effect of the research was seen across several ages groups, particularly in men in their 40s. This means you are probably out of the age bracket if you are over 40. You are. Gentlemen in the house, you must understand that most prostate issues are not cancer, but they can still cause discomfort. Yes, they can still cause discomfort. Now let's take a look at common prostate cancer, prostate condition. Number one is called BPH, benign prostatic hyperplasia. This is non-cancerous enlargement of prostate. It is a common part of aging for men because the prostate surrounds the urethra, the pee pipe, what you use to pee. When it gets bigger, it squeezes that tube, which is why most BPH symptoms are related to going to the bathroom. Yeah. So now, BPH starts in the 40s, 50s. And this is when you begin to see symptoms like a weak stream, nighttime urination, or you feel of a full bladder. This is BPH. Now, for the benefit of those who do not understand what benign prostatic hyperplasia means, let me tell you what it is. Let me break it down for you. Because a lot of people are having the same symptoms I'm talking about, but they think it's something else. They either think it's prostate or something else. But when you listen to this, you will know exactly what the problem is. And you'll be able to take care of it on time before it is too late. Now, when you hear the word benign, B-E-N-I-G-N, benign. This means it is not cancer, and it cannot spread to other parts of the body. Meanwhile, when you hear the word malignance, it means the organ is cancerous. If you go to the hospital and do the test, and you see benign, it is not cancer. If you see malignant, it is cancerous. Okay? Now, when it is cancerous, they can invade nearby healthy tissues. And most importantly, they can break away and travel through the blood of lymph system or to other parts of the body. When this happens, when the cell becomes cancerous and spread to other parts of the body, that is what we call metastasis. Now, what is hyperplasia? Hyperplasia is just an overgrowth of cells. Knowing about BPH is important. It is important because having BPH does not increase your risk of getting prostate cancer, though the two conditions can exist at the same time. If you have BPH, you might notice something like this. Slow start. The slow start is when it takes a while for the urine stream to begin. When you are feeling like you want to pee, and it takes you a while to pee, that means the stream, the urine stream, it's not releasing, it's not coming out. It takes a longer time to release. That is what we call slow start. We have weak stream. This is when the flow is weak or stop and starts. When you're trying to pee, you pee, stop, and you start again. That is weak stream. We have frequency. Frequency is when you feel like you have to go all the time, especially at night. You have to go to bathroom all the time. Some of these signs are also in prostate cancer. So that is why I'm telling you the difference now. This is what you feel if you have BPH. Urgency. We also have urgency symptoms. Notice this. This is when you have sudden strong need to pee that is hard to ignore. You can't even hold it. You cannot ignore it. And it's very, very painful. You just have to push it out. We also have dribbling. That is after you think you are done urinating, the urine comes to drip again. It continues to drip. You finish urinating, yet you still see your pants getting wet. That is the sign of BPH. And the last signs I'm going to talk about is incomplete emptying. You feel like there is still more in there, even after you have finished urinating. That can happen. You thought you are done, but you still feel something is in there. The bladder is still full. When you notice all these symptoms, it is benign prostatic hyperplasia. It is not cancer. It is just non-cancerous enlargement of the prostate. It is not cancer yet. Number 2 is prostatitis. Prostatitis is the inflammation of infection of the gland. Prostatitis is the most common prostate problem for men under 50. Pay attention to that. If you are 50, this is likely happen. It is likely to happen. And this is when a man begins to have symptoms like pain in the pelvic area, burning during urination, and fever, if it is acute. What this means is that if BPH is about the prostate being too big, the prostatitis is about the prostate being inflamed or infected. You see the difference? That is exactly what I'm talking about. That's the only way you can differentiate both. Now let me tell you the difference in these two so that you can have more understanding of it. Because people get confused because they both affect the same small area. Think of it like a mechanical problem versus a biological reaction. Yes. BPH is the mechanical problem. What is the problem? The prostate has physically grown in size. It's like a balloon that has been overinflated. So what happened? Because it is bigger, it squeezes the tube we call urethra. It squeezes the tube that runs through its cancer. Now, here is the analogy. Imagine a garden hose with a heavy rock sitting on it. A garden hose, the one you use to wet your garden, and so the hole that holds the water, that passes the water pipe, hose pipe. Imagine that with a heavy rock sitting on it. can water get through? The answer is no. The water cannot get through because of the size and pressure on the rock. That is BPH. You cannot pee because something is sitting on that pipe. You can't. And when it comes to prostatitis, prostatitis is a biological reaction. Yes, prostatitis is a biological reaction. What is the problem? The problem is the prostate is irritated, is red, or is under attack by bacteria. BPH is not attacked by bacteria. It's just that something is resting on it that prevents pee from coming out. But when it comes to prostatitis, it is something that something attacked that prostate. Okay? It is not necessarily large due to growth. It becomes swelling because it is angry or infected. And now what happened? The tissue becomes sensitive and painful. That's what happened. Why what happened to the BPH is just that the pee will not come out. When it comes to prostatitis, it becomes sensitive and very, very painful. It's like having a sore throat, but inside your pelvis. That's the way it is. Now you are going to look at it like the same pipe that is raw and blistered on the inside. It is not a rock on the outside. The os itself is sick and inflamed. That is the difference between the two. Okay? Now, all the prostatitis is the same. Yes. All the prostatitis, they are the same. Now, there are 4 types of it. 4 types of prostatitis. Number 1 is acute bacterial prostatitis. This is when a sudden severe bacterial infection occurs. It feels like a bad flu combined with extreme pain while urinating. This is a medical emergency. It requires immediate antibiotics immediately if the test is done. But for you to know that this is it, you will feel the pain, you will have the flu. Okay? Now we have the second type of that prostatitis is chronic bacterial prostatitis. This is a lingering or recurring infection. Yes. You can feel mostly fine for a week, then the symptoms flare up again. That is chronic bacterial prostatitis. The second type is chronic pelvic pain syndrome, CPPS. This is the most common type of prostatitis, that about 90% of prostatitis is CPPS. So if you go for a test and they do the test, they say it's a chronic pelvic pain syndrome. There is no infection found, but you have persistent pain in the pelvis, genitals, or lower back for months. That is CPPS, chronic pelvic pain syndrome. And the last one is asymptomatic inflammatory prostatitis. You have no symptoms, but a doctor finds inflammation during a different test. Usually, this doesn't need treatment. The inflammation disappears in a few days. Yes, that's what happened. Now, unlike BPH, which is mostly about a weak urine stream, prostatitis usually involves pain. And now, where do you feel the pain? Which area in your body feels the pain? The pain zone. The pain zone are lower back, your rectum, your testicles, or the perineum. Perineum is the space between the scrotum and anus. your anus. Okay? The space between the scrotum and anus is what we call perineum. Now, you feel the burning, intense stinging when you urinate. When you urinate, you feel the burning. That is prostatitis for you. Sexual discomfort will also happen. Pain during, after you ejaculate. When you are ejaculating, you feel the pain. After you finish ejaculating, you also feel the pain. That is sexual discomfort you get. You feel flu-like symptoms. Flu-like symptoms. You feel like you have flu, fever, chills, and body ache. This happens mostly in the acute bacterial version. Yes, when it is very, very acute. Now, some things cause and trigger prostatitis. What could have been the reason? What triggers this prostatitis? Bacteria can cause it. The same bacteria that cause UTIs, the E. coli or Staphylococcus, they can cause it. Nerves damage can cause it. Injury to the lower urinary tract from surgery, from trauma, that can cause it. Stress can cause it, especially for CPPS, chronic pelvic pain syndrome. Stress can cause the pelvic floor muscle to tighten, leading to chronic inflammation. And lastly, physical irritation can also cause it. Activities like long distance cycling can sometimes irritate the area. Yeah. The third common prostate condition, I've talked about BPH, I've talked about prostatitis. The third common prostate condition is called prostate cancer. That is why we are here today. Prostate cancer. I gave you all these two other common, prostate conditions for you to understand the difference between the two. Okay? So difference between the three. For you to know, when you begin to experience the symptoms or you are seeing the symptoms, you'll be able to know what is the problem, what actually happens to your body, especially to your prostate. So now let's talk about prostate cancer itself. This malignant cell growth within the gland, and you begin to experience the following symptoms. And if you do feel these symptoms, this key warning symptom, please see your doctor or any healthcare provider if you notice, number one, blood in your urine or semen. Even if it only happens once, you need to see your doctor. You see blood in your urine or blood in your, when you release, you see blood in it. Something is wrong. If you notice a weak or interrupted urine stream, like you pee and stop, you pee and it stop, or you feel like you have finished urinating and you still feel that something is in there, that is a weak or interrupted urine stream. See your doctor, please. If you notice frequent urgent need to urinate, especially at night, see your doctor. If you notice pain or burning during urination or ejaculation, see your doctor. If you notice new persistent pain in the lower back, hips or pelvis, see your doctor. Now, what do you do to prevent prostate condition you have, if you have one? What do you do? You need frequent, regular ejaculation. You cannot miss, you can't even beat it. You can't. Prioritize sexual wellness. Maintain regular activities. Don't forget the rule 21. The 21 rule. 21 times per month, at least, is a natural protective factor to the prostate. If you cannot do 56 that I calculated, at least you can try 21. 5 times, you can start from 3, then you graduate to 5 or 6. If you can do that, you can do this 2 times a day, or if you cannot do 2 times a day, because there are some women, they don't even want to talk about it. When we get married and we start having kids, some can still do it, maybe first child. When it becomes second child, they get weak, they get exhausted. It's like those kids came to take everything that belongs to their husband from them. I don't understand. Why you still see some women out there, whether they have kids or they don't have kids, they are still enjoying it. What happens to you if you don't feel like doing it? Something is wrong with your libido. Go and work on it. It's like you don't cook for your husband in the house, and somebody is selling food out there. If it's not stupid, he will go out and eat. That is the way it is. If you cannot satisfy your husband, somebody out there will do, of course. I'm talking to my gender now. We are done hearing this. Come on. This age we have now. We cannot afford to lose anything, including our husband. We can't. Don't get me wrong. Some don't lose their husband due to this sex. Some are still giving their husband. But yet, their husband is still, they're still looking out there. It's okay. But I am telling you that there are some men that are so dedicated to their wives, yet they are not getting that, fantasy, all this luxury in marriage. They don't get it. These are the women I'm talking about. I'm talking to you today. If you need to see the doctor, go and see the doctor. Next week I'll talk about women. I think I can talk about, because I still have some other things to talk after this to finish this particular section in the topic, because I'm not going to finish it today. So next week I'll complete it. Then the following week I'll talk about women. Women who could not have these feelings. They don't have libido. It's not working for them. They don't feel it. Something is wrong with your libido. It's wrong with your clitoris. I mentioned it last week. You need to see a doctor if you don't want to lose your husband, and if you don't care, then you don't care. Someone that cares will take it and maintain it for you. And don't come to social media and be crying and be telling us story. We don't want to hear it. I look at all these bloggers talking about people's marriage and how they steal the husband, come on, how is that your business? Do you really know how the family, the marriage works? Do you really know what is happening in that marriage? You don't. That is why when they are talking about anything that has to do with marriage and it's about sexual activities, I don't get into it because I know what happens. Men speak to me a lot with their problem. And there are some men who they don't want to lose their wife. So they keep to their wife. Despite that they are not getting that sexual, satisfaction. Those are the men that are prone to, they are at risk of cancer. We are talking prostate cancer. Because, and I'm very sure that you're not going to do it outside, and your wife is not giving it to you. And probably you don't know how to get it out. You cannot masturbate, you cannot do anything. So how do you get it out? How? How are you going to do it? So the first thing you are going to do is frequent, regular ejaculation. How you are going to do it? I don't care. I don't know how you are going to do it. Whether you are going to masturbate, you are going to have intercourse, you are going to sleep with the dream and be doing it, just do it. Make sure you get that thing out. That is what is important. And number 2, you are going to do regular screening. PSA test. It is important. If you are a man and you are above 40, talk to a brother. I think about 2 years ago, I asked. I think he actually complained of the teeth pain. And I asked, how long did you check your teeth? It sounded like I was talking something he has never in his entire life heard. He said, what is that? Do I have to? I'm like, Jesus. So since you were born, and it's over 50, you have not tested your teeth? Nothing. He said, no. And here in America, you have to test, you have to check your teeth, you have to check your eyes, you have to check your ears, your blood, your everything that breathes in you, every organs in your body, you have to check it at least one time a year. And someone over 50 is going to be telling me that he has not even done one test to that teeth. Imagine PSA. So if you are 50 and above, I believe you should be, by now, you should have up to 3 to 4 times at least test done. Yes, and if you are below that 50, if you have any symptoms that I just mentioned, please see your doctor immediately for that test. Same thing. To a woman, you are the age that you must do your mammogram. But if you have symptoms that relate to this breast cancer, even if you are not of that age, of that mammogram test, you need to see your doctor for mammogram test immediately. So PSA test is important. That is the regular screening you must do as a man. It's a simple blood test that measures prostate-specific antigen. The high levels can indicate BPH infection or cancer. If you do high level of that test, it can indicate either BPH infection or prostate cancer. But if you are not doing it, how will you be able to know? Or how are you sure that something is going on there? And that's why you see a lot of men dying of prostate cancer. Nobody should die of prostate cancer or breast cancer if you do your annual check, annual screening on time. You detect it on time. And the solution comes on time. But inability to go and screen yourself, this your body. You can take your body to party. Some go to party Monday through Sunday. Some every weekend they go to party. But to take that one day, to dedicate just one day and test their body, check their body. Body you take to the party and dance and jump. Body you take to work and go up and down. You can't even check if something is going on with that body. Oh, that is unfair. It is unfair. You see people dying of prostate cancer because they didn't check on time. By the time they now start feeling the chronic symptoms, they get to the hospital, they tell them it's stage 3, it's stage 4, when there is no solution, when it is too late. Come on. Come on. So please do this test. There is another test you can do, digital rectal exam. This is also a physical exam where a doctor feels the prostate for lumps or abnormality. When do you start to screen these two? Now, most experts, those experts, urologists, they suggest screening at age 50 for average risk. Now, when it comes to age 45, that is for African American men, or those with a family history. When you are age 45, go and do it. And age 40 for those with multiple close relatives who had prostate cancer. If you have family with prostate cancer, and you feel the symptoms, or you don't feel the symptoms, the moment you realize that in your family, this usually happens, and you are 40, please do these things. Let them, if they tell you it's not of your age, tell them it is your family thing. And you have the money to pay. After all, they are not doing it for you for free. Now, the third thing you need to do to prevent this is lifestyle. Lifestyle. You need to maintain a healthy weight. Eat leafy greens like kale and broccoli, and reduce red meat intake. Now, I want to direct this to African men, Nigerian precisely, because I don't know what is happening in other countries. Men, when you go on social media, you see them, I don't want to mention him, you see them eating, and on that plate, you will see the swallow like this, and you will see meat. Jesus. They will put meat like 10 people want to eat it. And why do they do that? They are telling you, they are showing you up, like, I have the money to buy it, I am wealthy, I am okay. That is why they are doing all this nonsense. Not knowing that they are hurting themselves. You are intimidating us. And meanwhile, you are actually directly, it's not indirect, you are directly hurting yourself, because those red meats can cause problem in your body. I think I have to come here and tell you what your plate contains. You don't need too much of proteins in your plate. What you need more is your micronutrients. Micronutrient, and that is vitamins and minerals, vegetables and fruits. That takes 50% of your plate. What do you need meat for? For what? Who cares whether you have money to buy it or not? What we care about is your health, your wellness. That's what is important. If I put food down and I don't have meat, or have just little 25% meat protein, it's not because I don't have the money. No. It's because I want to live longer and look beautiful within and out. Come on, don't come here and intimidate us. Please, reduce the red meats. You don't need much of protein. Not at all. Because the study shows that these are linked to better prostate health if you reduce your red meats. Yes, there's something we call lycopene-rich diet. The study shows that antioxidants like that lycopene found in cooked tomatoes, not the fresh tomato, the cooked one, can help protect prostate cell. You see that tomato, just you can steam it, you make it to prepare your soup. There is something there is antioxidants called lycopene in that tomato. It helps protect prostate cells. And once you are able to protect your cells, it is impossible for cancer to attack that cells. And that is why I always tell people that what you eat is what you are. What you eat determines how the cancer cell grows in your body. And don't forget that every human being carry these cells, cancer cell. How they now grow depends on what you feed them. What you feed those cells determines how whether they live or they die, whether they grow like cancer or not. So you must feed this body with good food. Start this dietary habits early to provide you decades of protection. If you can start early, anytime you are 50, 60, I'm afraid if you have not been doing this. But for younger ones, please start it early. This dietary habit, start it early now. It will provide you decades of protection. Yes. And when it comes to weight management, I'm talking about obesity in younger years, it's often linked to more aggressive forms of prostate cancer in later years due to hormonal changes and insulin levels. So if you are young and you are obese, you need to start working on it now. You need to reduce your weight now. When you see me like this, you think it's a joke? You think I don't want to get big so that people can see me? They be calling me mama, mommy. No, that is not what I'm after. I'm after my head. That's why I look like this. So when you see a child looking like your mommy, something is wrong somewhere. You need to work on it. Lose that damn body. Get it loosed. Come on. You don't need it. For what? Besides, it makes you spend so much because you'll be when we are buying size 6. This dress now. You know what size is it? A size 8. I can wear 8, I can wear 10. I can wear 6, depending on how the clothes is cut. And when I dress, I look good because I have the shape. But when a child look like a 80 years old, what is going on? Where is that coming from? What? You are at risk of this prostate called cancer. Work on it. Work on your weight. Manage it. Whatever you want to do, exercise, diet, do it. It is important. Now, here is what I want you to take home. Take it home. Think about it. Meditate upon it. Write it somewhere. Whatever you want to do to it, I want you to have this. I want you to think of your prostate health like a retirement fund. It is important. You can beat it. Most of us, we have retirement fund. Think about your prostate health like that. The earlier you start investing in good habits, the more protection you will have when you reach 50, 60 and beyond. Yes. You will. Don't be deceived or get confused out there. You don't get cancer from a lack of sex at all. You don't. Whether you have sexual intercourse or you masturbate or you do things, you are going to get that fluid out of your body. If you don't do it, that's where the problem is. So kerewa kolon fa cancer o, e ma tora yin o. No, it's not. The ability to get that fluid out, whichever way you want to get it out, that's what prevents you from getting cancer. Yes. So you don't get cancer from a lack of sex. However, keeping the prostate active through regular ejaculation is considered to be a healthy, proactive habit, similar to eating a balanced diet or exercising. If you don't know that, I'm telling you today. And also make it your priority to see a doctor if you cannot pee at all. If you realize that you cannot pee, if you see blood in your urine, or if the symptoms are keeping you from sleeping or enjoying your day, please see your doctor. It is important. You feel the pain or something is wrong somewhere, and that low in the middle of the night, you always getting up and urinating. You can't even touch your wife. Or maybe when you want to touch your wife, the time you want to start, it is when you're feeling like you're going to the bathroom. How do you want to get it out? How do you want to do it? Please speak to a urologist. Speak to a doctor. I don't know how it's done in Nigeria, but here you need to speak to a primary care doctor. And the doctor will refer you to urologists. These are the doctors. Urologists are those who specializes on things like this. They will find out what is wrong. They will, if it is cancer, they will now refer you to oncologists. Oncologist specializes on this cancer. Any type of cancer, oncologist specializes on it. That's the area of their specialization. So they might go more by fortune. Don't go and be seeing the doctor that take care of the eyes, ophthalmologists, or you want to go and see other doctors that deal with any part of the body, instead of urologists to oncologists. It is important, because by the time you are going to the wrong places, it might be too late for you to do that. Now, how do you achieve ejaculation if you don't have a partner? How do you do it if you don't have a partner? What happens after 30 days of not ejaculating? If you stay for 30 days, you don't ejaculate. I'm not going to talk about sex, because it has nothing to do with sex alone. I'm not saying you should not have sex to get it out. It's part of what gets it out. And when you are doing it, it's not just doing it. You have to get it out from your body. So if you are having sex and you are not coming, you don't release. That is where the problem is. You are just wasting your time on there. Your wife must be able to come, and you must be able to come. I'm telling you this. If you don't know, I'm telling you. What is most important to me is come out. Get that thing out. That is it. If that thing comes out, whatever happens, I don't care. So if you are not able to do it at least 30 days, what happens? And how do you achieve ejaculation? How do you come if you are unable to do it? Let's talk about it next week. I'm going to